Okay, I'm gonna do IV push. So I have my MAR. I'm gonna be doing furosemide, 40 milligrams, IV push. This is for, this is a diuretic to help with heart failure, hypertension. So I did my first 2 checks at the Pyxis. I'm now at bedside. I'm checking my patient's wristband against my MAR. So I have the name, the date of birth, and the MRN. I already drew up my furosemide and labeled it in the syringe, and then according to the drug guide, I can push 20 milligrams per 1 minute. So I'm going to be doing this over the course of 2 minutes, which means I'm going to push 1 ml every 30 seconds. So I did my hand hygiene, and I'm going to put on gloves. The first thing I'm gonna do, well, I'm gonna ask my patient if they have any allergies to this, and then I'm going to assess their IV site. So I'll clean the hub for 15 seconds. I have a flush of normal saline. Make sure there's no air bubbles in there. I'm gonna attach that. And first I'm gonna draw back to check for blood return, and then I'm gonna push. Unclamp this. Yep. Draw back for blood return, and then I'm gonna push and make sure there's no signs of infiltration or pain or swelling or anything like that. And then I have my furosemide. I'm doing my last check at the bedside. I have my 40 milligrams IV push. So I'm going to disconnect my flush. I'm gonna connect this. And so this tubing is already 0.5 mLs. And since I'm doing 1 ml per 30 seconds, my first one is actually gonna be 1.5 mLs. And then I'm gonna wait 30 seconds. And then I'm gonna push 1 ml. And then I'm gonna wait 30 seconds. And then I'm gonna push another 1 ml. And I'll wait 30 seconds. And then since there's only 0.5 mLs in here, I will finish that off. And then continue with the flush, another 0.5 ml. And then I wait 30 seconds. And then I can push the rest of the flush. And then I can convert this to a saline lock. While I'm pushing it, I can lock this in place to create the positive pressure, and then disconnect. I will discard of these into the sharps container, and I'll make sure my patient isn't having any adverse effects or any pain, and that's it.